Okay, so we have Octavia here with us today. Octavia, if you could introduce yourself, first and last name, and state the organization that you currently work for.
I'm Octavia Jones, and I work for the Cleveland Department of Public Health.
Wonderful. Thank you so much for being here today and for joining us on this podcast. And I hope you're enjoying CHW Day so far.
Love it.
So we do have some questions we'd like to ask you. And the first question is, why are CHWs essential to public health, especially coming from someone who works at the Department of Public Health? I'm sure you can connect that very easily.
Yeah. So this is actually, I would say, a very kind of new experience for me because I typically didn't work directly with people until I became a CHW. And then I worked directly with people. So in my position, I work with a lot of people as opposed to one-on-one. So a lot of my work in the community is speaking to groups, educating groups on different health topics, making sure that they understand the information that is digestible for them. A lot of times I love seeing how groups are engaged. They ask questions. They follow up with the information. They thank me for coming. They're like, yeah, I learned so much. I can't wait to share this with my friends and family. My sister had questions about this and now I can give her answers. So I love being able to provide that information for them that's actually credible and science evidence backed. Mm-hmm. So a lot of times, like, we have the social media hype and AI now is very, very invasive. It makes stuff look very convincing, emotionally impactful. So people take that with them as fact, and it's a lot of times it's not. Mm-hmm. So a lot of my work is geared towards trying to combat that issue, and then also just empower people to ask questions. Like, if it can't stand up against the questions that you ask, then it might not be useful information. And make sure you're vetting the sources that you're getting this information from. Do they have an agenda? Is there a reason why they're trying to turn you away from going to see your doctor regularly? Listening to your doctor, having questions for your doctor. And I also work to empower people to understand that you are your own expert. So don't just go in there and think the doctor knows everything about you. They're not with you every day, all day. So if they're not listening to you, go ahead and find another provider that you feel you can trust and that will listen to you. And a lot of times that helps them understand that, yes, I'm on this medication. I don't really take it because I don't like the side effects. And I just tell them, like, write the side effects down. Tell your doctor. Because if they don't know that you're going through it, they can't adjust your medication. And they're like, oh, I didn't think of that. So just providing different perspectives from a grounded place for people is very important for them to actually take advantage of the healthcare that's available.
Wow, I think that's amazing work that you're doing to help to bust a lot of those myths that are out there and helping to empower people to take agency of their own health with real information that they actually need. So it sounds like you do a really interesting, we have an interesting perspective of, like, the work that you do as a CHW, since you do a lot of group-based work. So what kind of advice would you give to someone who's considering a career in community health work and becoming a community health worker?
I would definitely say, do not stop learning. Go and find the information about any and everything, because everything affects people's health, essentially. Like, the social determinants of health are across all areas of life, where we work, where we play, where we get our health care, where we eat. Like, literally everything affects that. So having as much information as possible to understand someone's situation when they come to you with an issue is very important. And then also building those connections and partnerships and networking, because you might not be able to help somebody, but you might know somebody that knows somebody. And it's like, oh yeah, I met somebody at this event I went to, or this training that I did, or, like, I know a ton of people virtually just from all the Zoom trainings that I do. So just be involved and always look for ways to grow yourself and your network.
That's wonderful. Well, Octavia, thank you so much for sharing the important work that you're doing in your perspectives on things. We really appreciate it. And I hope you enjoy the rest of CHW Day today.
I'm absolutely looking forward to it. Thank you.
Great. Thank you.